Okay, welcome. Good morning, good afternoon, good evening, everyone. Depending on where you are coming from, welcome to ISSUP Malaysia webinar in country INEP Plus journey, INEP Plus training journey and lessons. My name is Mimi Omar. I'm from OPTA. OPTA stands for Organization for Addiction Prevention, Treatment and Recovery. We are based in Kuching, Malaysia, and I'll be your moderator for today's session. Thank you all for being here. Meanwhile, in your chat, can you just check in, just type where you come from so that we know, uh, where we know all the participants coming from. Since we have an international group here, yeah, don't forget, chat, type in your chat. So, wow, am I seeing anybody chatting now? Let's see. Wow, we have 83 all over the place. Thank you all. We have from Malaysia, we have also other parts of Europe. Wow. Okay. Let's move on. We are excited to have a global audience with us. It's 8 p.m., about 8:06 in Malaysia, which is about 1 plus in London. So we truly appreciate you making time to join us across different time zone. Today's sessions will share ISSUP Malaysia delivered the INEP Plus training for our local context. Yeah. So before we get started, a few quick housekeeping points to help the webinar go smoothly. Duration of our webinar is for an hour. If in case you have Q&A to ask, it will be towards the end, but you can type the questions and we will answer. We try to answer to your questions. Feel free to type your question anytime in the chat box. Yeah. And for engagement, you would be muted, you know, your microphone is muted to avoid any background noise. So, all right, with the notes out the way, let me introduce you to our guest of honor. Yeah, I'm very proud to introduce Dr. Rakeli Donini, co-developer of the INEP Plus course, along with the late Jeff Lee. Dr. Donini is a psychologist and a psychotherapist with extensive experience since 1995, yeah, in clinical and prevention settings. She's currently heading the drug prevention units at the Public Local Health Agency in Savona, Italy. We are honored to have her with us today. I would also like to introduce our speakers for today. Mr. Abel Ahing, looking good there. He is the lead INEP Plus facilitator at ISSUP Malaysia. Abel has over 12 years of experience in the healthcare industry and more than 15 years of leadership in social service program. And Cindy, welcome Cindy. Unfortunately, we can't seem to get her on video. Some technical issues there. He is director of ISSUP Malaysia and the founding president of OPTA, where I am too. Cindy is a highly experienced trainer with over a decade of international experience. She's also a registered counselor and a prevention trainer. And of course, later on, we have our two INET Plus alumni, Ms. Yasota Krishna and Dr. Zeti Nadia, who will share with us their INEP Plus experiences. So, everyone, just to do another ice-breaking poll, yeah? Kwado will share with us, how familiar are you with INEP Plus? Yeah? So, just in case, to get, just type your answer and we will see how you do later on. So I'll give everyone just a moment. We only have 1 hour, so we are rushing for time. So go ahead, click your option, and then your responses will give us an insight. So wow, I can see a lot of responses coming in. Yeah, we will. Oh, it's a mix of experiences levels here. Never heard of it. That's 53%, right? I'm a certified. Good. Okay. Now that we've warmed up and acquainted, we can see where you're coming from. Let's dive into the main content of the webinar. I would like to invite our guest of honor, Dr. Darkeli Donini, to give her opening remarks. Over to you.
Thank you, Mimi. I'm honored to be here together with you, with Abel and Cindy, and together with Jeff Lee. I'm one of the developers on behalf of ISSUP for the development of the INEP Plus. I will very shortly share how it began, all this great adventure, and I'm so happy to see that in Malaysia things are improving and working. So, okay, can you see my screen?
Yes, I can see your screen.
Yes, you
Yes.
can. Okay, great. So, what about INEP Plus derives from the online INEP, which stands for Introduction to Evidence-Based Prevention, and it was developed by CUNY University in Prague. It is an online self-paced course made up of 10 lectures. It's about 40 hours of training, and all the materials are in English. And these are the contents of the different lectures. We have 10 lectures, and the topics are about epidemiology, substance use, family-based prevention, school-based, workplace-based prevention, and then community, environmental, and media-based prevention, together with monitoring and evaluation. So thanks to Jeff Lee, who had this really great idea of offering a facilitation of INEP, we now have the INEP Plus course, which puts together the INEP online course developed by CUNY University, together with a synchronous training offered by ISSUP, which helps to deepen the contents of the online self-based administered course. So ISSUP decided to take the INEP course to offer it to its national chapters to empower their competences about prevention, and to really offer a course for beginners to start the ladder in deepening and understanding prevention science. So the structure of INEP Plus, it is provided virtually online, but I know that some national chapters did also offer it face-to-face. It is a 12-week course. Every time, each week, people take the online INEP course, and then we meet together to deepen the contents in a synchronous online meeting. And up to now, we've had 4 courses in English led by Jeff Lee and me, and 1 in Spanish led by Jose Benitez in Mexico. The methodology is a group work with peers, a deepening of the contents through plenary discussions and breakout rooms, and then based on the questions of the participants, the trainer deepens selected topics that are of interest of the participants. So the strengths here of having it online, we were able to cover and to reach so many different countries, 32, and to disseminate knowledge on evidence-based prevention. The limitations were due to the online delivery, where the interaction is obviously limited compared to the face-to-face. and we have to understand that this is an introduction to evidence-based prevention. It can be a starting point to deepen an understanding about prevention that wants to be a little bit more thorough and
You have 30 seconds to go.
thank you very much. I have finished with my presentation. Okay.
Thank,
Thank you.
thank
And
you.
I'm so
Thank you,
happy
Dr.
to be
Kelly.
here with Abel and Cindy, who are the Malaysian facilitators of INEP Plus. Congratulations to them and to their force and courage to provide INEP Plus in your country. Thank you.
Thank you, Dr. Rakeli. We move on to Abel.
Okay, Abel here. Thank you for having me. So what I'll go through is actually ISSUP Malaysia's experience in implementing and delivering INEP Plus training course. So you get to learn from our perspective what sets INEP Plus apart from uh, other prevention training. You hear our approach to delivering the program, the lessons that we learned, and later you also hear from not three but two of the alumni of INEP Plus that we have conducted. Yeah. Okay. This one I think I don't need to go through this about INEP Plus because Rakeli has gone through this very clearly. Yeah, just that maybe she didn't mention the reference material, but the reference material for those of you who don't know INEP Plus yet is the EUPC, the European Prevention Curriculum, the Universal Prevention Curriculum, the European Drug Prevention Quality Standards, the UNODC, International Standard on Drug Use. Yeah, so these are the reference material during the training. Okay, this is ISSUP Malaysia's perspective on INEP Plus. So to us, it is not just a training course; it's actually a systemic capacity building thing, for building a national capacity as well as local within the national areas. Yeah. So we find that it is solidly grounded in adult learning, and that's what set it apart from other prevention training. It's to us it's like the gold standard in uh, the beginner prevention training. Okay, everyone. I was talking about ISSUP
We
Malaysia's
didn't,
perspective on
we don't have,
implementing. Can, can you hear me?
I can hear you.
Okay, I was talking about ISSUP Malaysia's experience about the INEP Plus training course. So, in our perspective, uh, INEP Plus is not just a training course. It's actually we call it a systemic capacity building for prevention capacity building in the country. Yeah, and it is set apart from other prevention training. It is solidly grounded in adult learning. The fact that it's online, it is self-paced. It has low cognitive load, which means it is not that difficult for adults to follow through and learn. And there's the adult collaborative learning, which is very suitable for adults in the work group sessions that Rakeli mentioned earlier. Uh, it is foundational. It covers all the domains of prevention, such as epidemiology, etiology, and prevention science, advocacy, about ethics. It covers all the major prevention settings, such as in family, in schools, prevention in community, prevention in the workplace. And it has theoretical foundations. If you notice, Rakeli went through the 10 lectures, so it covers those things and is grounded in the global standards that I mentioned earlier, which is the EDPQS and the UNODC international standards on uh, drug use prevention. Yeah. and it's sequenced. It's very well sequenced. Rakeli and the late Jeff have really gone through very well in building this, make it a scaffolded logical flow for learners to be able to follow through from the basic foundation to towards the domain, so that they can gain other skills and be able to take it and implement in their settings. Yeah. Here's what we call INEP Plus has democratized prevention training. So it's available for everyone, anyone who is interested in learning about prevention, in knowing how to start implementing evidence-based prevention in their own setting, in their community, in their family, in their school. So just about anyone. It's not just for scientists and not just for academicians, yeah, or not just for healthcare professionals, yeah. And like I said, it's not just a training course; it's a systemic intervention, and it helps you to, get the nation to build a prevention infrastructure. So nurturing competent facilitators that is aligned with the global benchmarks. Yeah. I now hand you over to Ms. Cindy Bidding to go through our whole story, what we have done in delivering INEP Plus courses. Okay, Cindy, are you there?
Yeah,
Cindy?
yeah,
Okay.
I'm here. I'm here. First, I must really apologize for not being visible. There's something wrong. I can't get my camera on. So let me just share a little story about how INEP Plus started here in our country, Malaysia. Ashwin, my colleague, and myself joined cohort 3 of the ISSUP Global INEP Plus Facilitator training. At that time was conducted by Rakeli and the late Jeff. The training ran from September 22nd to December 14, and that experience really opened the door for us to bring the program to Malaysia. And by March 2023, Ashwin and I were ready to start our first in-country training. So we ran 2 online cohorts back to back. That was cohort 1, cohort 2, and completed them by May 2023. It was an exciting and meaningful start. Then in 2024, that was last year, Abel and I continued with another round, cohort 3, from July to September. And just more recently, we completed our cohort 4 from February to April. And that is, that was our last cohort. Yeah. So what's been truly encouraging is the diversity of our participants. They come from all walks of life, but they all share one thing in common. That is a strong passion for prevention. And that's what makes this journey so meaningful. Watching a growing community of prevention champions come together and take this work, take this work forward in Malaysia. And looking back, it's really incredible how we have come in just a few years. And looking ahead, I believe we are only just getting started. So with patience and commitment that we have seen, I'm really confident that prevention science in Malaysia has a bright and impactful future. I would like to summarize what
our previous participants have said about INEP Plus, that they have been very much encouraged to move forward in their prevention training after attending the INEP Plus. For many, INEP Plus is a stepping stone for them to move in the direction of being a practitioner in prevention. From our feedback, they were all very happy and to be able to have the opportunity to join this INEP Plus training. So I would like to have two of our alumni to share their own experience from their own perspective. So introducing to you, Yasota Krishna, could you go first? Yasota?
Thank you. Thank you, Cindy. Um, Thank you for this opportunity for me to giving me this opportunity to share with the group on my experience attending the program, the prevention science. I'm an inner work teacher. I actually run an academy. I'm a principal of an academy where I offer inner work. And when I first saw the information on this program on LinkedIn, I was very called to take up the program because in my course of work, I deal with a lot of young adults, as well as adults who have experience um, or have challenges with substance addiction. And I did not have any experience or knowledge on how to manage. So I had to use only what I knew, and I thought that this course would help me to understand, go deeper, learn the intricacies of the whole prevention science. And I was very, very pleased that I got what I wanted from the program. What I enjoyed most about the program that I attended over the 8 weeks was that I was able to relate with participants from all over the world, and we could exchange situations and scenarios that was happening in different cultures, different challenges, different protocols. What worked in some countries may not necessarily work in other countries or other cultures. So that really fascinated me because that gave me an expansion of my own mind and perspective. And also the facilitators, I was very taken with the facilitators like Cindy, Abel, Mimi, because they kept us on track. um, because sometimes you feel like I may not be able to keep up, or I may not be able to, I might be very busy with work. And there were one or two times where I felt like maybe I may not be able to complete the program. But with the help of Abel, Cindy, and Mimi, I felt like they kept the group together, and they kept us going and making sure that we could catch up. We could have a lot of breakout rooms, so even if we miss out listening to some of the lectures, we still could pick up and come back on track. So that's something that I really, really appreciated from the facilitators. So this is a program that I would highly recommend to anyone, actually, whether you're a parent, you're a teacher, you're a counselor, you're a policy maker, or you're a community leader. This program is extremely beneficial and very, very enlightening, because it's a very step by step process and very
You have 10 seconds,
methodological.
yes.
And very
Sorry.
methodological. Yeah, so that's my input. And I'm actually very proud of myself that I actually completed the program, and I would encourage the listeners today to consider taking up the program, because I plan to pursue further too. Thank you for this opportunity.
Thank you. Yes.
Thank you very much, Yas. for that very inspiring testimony.
Thank you.
I would like to call upon Dr. Zeti, please.
Hi, hello everyone. Gentlemen. As
Your
mentioned,
volume, can you increase your volume?
ladies and gentlemen, thank you. It is an honor to have this opportunity to give a course feedback for today. As a proud alumni of INEP Plus course, ISSUP, this program has been transformative experience that equipped me with the knowledge and tools to make a meaningful impact in the field of substance use prevention. I would say that it's fair to conclude that INEP Plus course provided a robust foundation in the evidence-based strategies that blends the theories and practical application. I think the curriculum was thoughtfully designed, and of course, the facilitators were exceptional in their expertise and dedication. Their guidance helps us to understand how to apply the evidence-based approach to address substance use in a perspective of prevention. So as for myself, because I'm a senior pharmacology lecturer with an interest in the substance abuse prevention, so this course is critical for me as a newcomer to drug addiction education for many reasons. For example, now I am able to understand proven strategies because this course has introduced me to interventions and all the programs that are backed by rigorous research. So this will ensure me to teach or to use strategies that are effective in uh, substance abuse prevention. And I think my background as a in pharmacology aligns with the course focus on the evidence-based approach. So this also helped me with the to improve the ability to critically evaluate the studies, methodology, and the outcomes to identify and address, for example, the specific risk factors or enhance protective factors that tailors the prevention efforts to diverse population. So, and in terms of practical application, this course provide with frameworks for designing, implementing, and evaluating prevention programs. And more interesting is that this course include interdisciplinary uh, perspective. And then I think what stood out most was the collaborative environment fostered by the program. We have the opportunity to engage peers from diverse backgrounds, which enrich my perspective and inspired innovative ideas for prevention initiatives. And
20 seconds.
I want to extend my heartfelt congratulations to all my fellow alumni for completing this rewarding course. To anyone involved in prevention or considering this path, I encourage you to join in the Plus course because this program is a game changer that offer unparalleled insights and supportive network. And thank you for ISSUP for this opportunity. And I hope that the skills and insight I've gained will guide my work moving forward. And I think every one of us are excited to continue this journey alongside such a passionate group of professionals. Thank you.
Thank you, Dr.
Thank
Zeti.
you.
Thank you for your sharing your experience. Over to you, Abel.
Okay. Thank you, Cindy. Just a note, the two alumni, they had that was their own very candid opinions about their experiences. We did not help them or influence their script or what they said. Yeah. Now, what we added value, what value did we add to the INEP Plus when we conducted the INEP Plus? Number one is we added in real world case studies. Later I will show you. So case studies help illustrate how prevention works, especially the framework like, the theory of planned behavior, the behavior change wheel, and how they are applied to actual prevention programs. And case studies help bridge theory to practice, especially for beginner learners who struggle to connect the abstract theories uh, to real world scenarios. Yeah. So this case study serve as like, some cognitive anchor. Yeah. And we also have this group prevention project on session 6. The prevention project is assigned as their homework. They are broken into groups, and then they choose what they want to do on their project. Yeah, so it's something that it's like a capstone integration to the learning. So participants use the skills, the knowledge that they have gained from the previous sessions to create something meaningful that they can actually bring back to their setting and uh, have the possibility to implement it. So it helps participants practice what they have learned and show how well they understand it, and get feedback from their colleagues in the groups or in the plenary, and also most importantly prepare to apply it in their knowledge to the real world. So think of it like it is a final test, but more fun and useful because it connects learning to action. Yeah. Recaps, of course, we keep recap because it's recapping the previous sessions, the previous lectures, so that those who miss can also not miss, can learn as well, and those who have learned it, they can reinforce their learning. Okay, then we provided lessons from the field. The field meaning the work, the prevention work that we do out in the communities. So we bring back it into the sessions with the participants. Okay, so because we find those are very valuable things that we did not know before we started our own prevention work in the communities, and we share those things. Yeah. Okay, this is how we do the case studies, for example. So this is giving you example of how we bring case studies into the learning. Okay, for those of you who are familiar with case studies, like if you have attended the Harvard Business School Senior Management Program, for example, they do every day they do case studies for 2 weeks, because that's how effective adults learn, using case studies. So evidence-based prevention requires understanding of the theories that guide decision. And this is one theory, the COMBI. If you see the circle there is in the green circle is the capability, opportunity, and motivation. It is what drives behavior. And then the outer, the red and the white circles are actually what you do, what are the things you do to prevent or encourage behaviors. Yeah. So this is the COMBI model and the behavior change wheel. So the behavior change wheel and the COMBI model frameworks help us understand why people behave the way they do and how to effectively change those behaviors. Yeah. So COMBI explains the 3 key things that drive behavior, and the behavior change wheel is the practical framework for interventions. Okay, and this is behavior change wheel is great for illustrating that awareness campaigns or education alone do not have impact, and that is what and we learn in INEP Plus as well. There's little evidence that an awareness campaign alone works. Yeah, and knowledge alone does not change behavior, as research have shown that people who use substances have more knowledge about substances than non-users. Okay, but this does not prevent people from using. Yeah. So this structure helps prevention specialists or prevention professionals like yourself or those who are interested in prevention systematically identify what needs to change using the COMBI model, and then select the appropriate intervention approaches in the middle ring as and what are the supporting policies. Choose what are the supporting policies, the ones in the outer ring. Okay, so the behavior change wheel is a structured way to understand these complex behaviors rather than relying on a single approach that often fail. Yeah, and yeah, so this is how we present the case studies and how we do a recap. So actually, we recap previous lectures, previous sessions using the case studies. Yeah, in this case, it's the Icelandic prevention model, and you can find this in this link called planetyouth.org. You can also find it in the EUDA best practices portal. Yeah. So there you see the COM, the COM, the capability, opportunity, which is all the physical opportunities as well as the social opportunities, the motivation. This one I wouldn't explain it much because you can learn it later. But just here is just showing how we use case studies to illustrate theoretical frameworks. Yeah, so make it easy for participants to understand. Yeah. And this is another way that we present information uh, other than, so recaps may require other ways to visualize information instead of just bullet points. So this kind of a table offers a clear guidance on how policy efforts uh, are aligned with the desired intervention strategies. Okay, that's one way to visualize information besides bullet points. Yeah, and this another way. I think you see a lot of this also in the European prevention curriculum, but it's a way to present information that becomes more understandable. Okay, so it creates immediate visual distinction between, in this case, between what is effective and what is ineffective. Use icons to reinforce positive, negative categories and maintain the simplicity while organizing the information in a more logical way. Okay, so it helps create that physical, visual presentation of information. Yeah. So you can in other ways use things like a spectrum. You can have a spectrum rather than binary presentation of information from highly effective to counterproductive. For example, it's a way to visualize information, to present it. Okay, you can also use like this one. We use a Canva whiteboard. Yeah, the Canva whiteboard, so participants can they don't need to have Canva account. Yeah, so you can send the Canva link, and they can everybody can use this link to use the Canva whiteboard and do some interactive what do you call it, participation. In this case is to align where good prevention is and where is bad prevention, where is harmful prevention, for example. So it's a way of getting participants to engage and interact. Yeah, maybe enhance their learning. Yeah, and you as a facilitator, you can see on this right hand screen is the facilitator screen. On the left is the participant screen. So you can see on your own screen as a facilitator, or if there are 10 people attending your class, you'll see 10 of these things moving around. Yeah. So you can yourself try it out here if you would like to. You can scan this barcode or go to this link, INEP Plus whiteboard WB, and try it. It's the same link that you see just now. Okay. Then we have the group prevention project. Yeah, the group prevention project at the beginning of session 6, as I mentioned, is to collaborate in groups. It's to design a prevention program that they can use. So it's provides a deep experiential learning, and it transforms the course from content delivery to action learning model. Yeah. So it empowers participants to move from being passive to being creators of prevention plan, and it fosters group learning. See, here's an example of a prevention project, very impressive. This kind of project, this is just now you saw, we saw our alumni, Dr. Zetish is one of those who led this group, or who are in this group, who created this project. It's a prevention, school-based prevention program, and it's actually, if you are an organization that funds NGOs or fund community programs, this program, you are actually ready to fund it because it's very well presented. You can see the what impact. You start with the end in mind, the impact, and how they work towards working towards implementing the program. Okay. And they have applied their knowledge, the EDPQS, which the quality standards that governs how you, or that guides how you do the process of planning and implementing and monitoring prevention programs. Yeah. So we have another one here from cohort 3. This is a sample of a group project from cohort 3. It's also very, very impressive. So they even have the time to collect data, yeah, to collect data and then present it during the final day of the training course. Yeah. And okay, this is the one I mentioned about. We shared the learnings that we gathered from the field, from our work in the prevention in the communities. So these are, for example, very important things that we did not anticipate when we started prevention programs. A lot of barriers, or a lot of resistance, a lot of stigmas, for example, in this a lot of excuses, a lot of reasons people will not attend your program. So knowing all these obstacles and all that beforehand would be good, would be helpful when you start planning for your program. Yeah, and this is also the lessons that we shared from the field. For example, you need to follow the appropriate protocols for community entry, because sometimes some community may have elected leaders, but actually the real people who have influence in there are what they call the dynasty in the community, families who have been for ages been seen as people influenced, been seen as leaders in the community. But if you go through the official officers in the community, you may not find yourself very welcome, or people may not really support your program. But if you go through those dynasty in the community, the unofficial leaders there, but respectable what do you call it, leaders there, then it could be better. Yeah. And one thing is you have to focus on the strengths of the community. For example, we went to one community that actually have very strong, very cohesive community. Very cohesive community. When there are disasters, like there was a recent flood, they all come together and work together and help each other out from the flood. So that is the strength that you have to focus on, so that it helps build confidence. Yeah, in the community, it helps people get more motivated when their assets are recognized. So it avoids pathologizing or what do you call it, pathologizing or blaming, and it helps reduce stigma by not labeling communities as broken. It helps promote sustainable change, and strengthening existing protective factors that
You
are
have one
already in
minute to
the
go.
okay. Okay, so those are things that we shared, and we also shared this our strategic tool, this theory of change. Theory of change is how you achieve the real impact that you want to achieve in your program, in your prevention program. Yeah, uh, you can learn theory of change later, or you can ask us. And this is the summary of what we learned. Yeah. Uh, expect that most people, what we learn, most people expect to learn most from the facilitated sessions, not from the self paced lectures or from reading the materials. Yeah, and there's a cognitive overload in the early stages when people hear of epidemiology, you can't even pronounce it, etiology, it kind of overload them. So you have to break things up, make it more simpler, use case studies. uh, Regular learning pulse check is very important to ensure that you can improve as you go along. Yeah. Bring beauty into practice. I know this is not a science way of saying it, a scientific way of saying it, but it's like you you don't just use black and white bullet points, but you make the session interesting, because INEP Plus is already very beautiful. It's very well done, but science is very good. Science matters, but you have to make it more irresistible. Yeah. As someone asked during our cohort, how do you make prevention sexy? Yeah, people crave meaning, so you have to infuse purpose and vision into with the stories and case studies as you go throughout the training sessions. And as we can see during the project group work, with the group project, people actually rise to the challenge. Within that short period, they can come up with very concrete, very solid prevention proposals, and make the final session a learning showcase. Which means people present all their learnings through presenting the project proposal. And then one thing that we didn't quite do is actually review each proposal properly, so that it adds more value to it. Yeah. And uh, this is actually something that, what do you call it, an answer to the question of how do you make prevention sexy. It was asked by one of our participants in the last cohort, and it's actually, how do you apply the kind of this Rakeli during the facilitator training. She said, because I asked a question, how do you make prevention attractive to people, or make people want to come to prevention training? So she mentioned this, and I attribute this to Rakeli, who had this quote: "If you want to build a ship, don't drum up the men to gather the wood, divide the work, but you teach people to yearn for the vast endless sea." Yeah. So how do you apply that wisdom that Rakeli has made known during the session? So you apply this wisdom. It's about shifting the task-oriented approach to inspire the deep desire. Yeah, and it's about getting people to, it's about parents sleeping better at night. It's about kids growing up free from avoidable pain. It's about communities that heal instead of hurt. So it's really a powerful metaphor. And I thank Rakeli for bringing that up. And it's a powerful metaphor for building movements, for inspiring commitment and changing hearts in something as underappreciated as prevention work. Yeah, prevention work is very silent, invisible, underappreciated. So in prevention, the vast and endless sea is a community where people thrive. Yeah, where families are strong, where schools nurture potential, where workplaces support well-being, where individuals make choices, make healthy choices very naturally without enforcing policies, without enforcing rules and regulation. It's a natural choice that people make. Yeah. So a society where people grow resilient, the young people are safe, supported, free from harm, because we have not forced policies into it, but because families, schools, communities want to create that. So that's the C in this case in prevention. Yeah. Okay. There's a upcoming INEP Plus if you want to join that we are hosting, that we are conducting on June the 12th. Yeah, it's every Thursday in Malaysia time. It's 8 p.m. London time. It's 1 p.m. So you can scan the QR code if you want to join and learn about the evidence-based prevention in community, in family, in schools. So you can implement those things in your own community. Yeah. So your takeaway action is, as in the previous section I was saying, take the prevention training, take the INEP Plus training, help build a prevention ecosystem in your own country. Yeah, because somewhere in your neighborhood, there's a young person who is at the crossroads waiting or looking for help, or maybe need you to help him. Yeah, so that's what we need to do. We have to advocate for prevention. Okay. It's not easy work. Okay, I pass back
Okay.
to moderator.
Thank you, Abel. Thank you, Cindy. Uh, we like to apologize for there's a break just now in our webinar. There was some technical issue, but we're happy to get back on. We lose about 5 minutes. So now we are at 9:02. We have about another 5 minutes to go. We give that additional 5 minutes to cover the lost time during the technical hiccup. I can see that we have questions, yeah, that participants have put in the chat box, and one of it by Joran Salberg, if I pronounce that right. Isn't this approach to addiction very Western centric? So, who would like to answer that? Would Abel, Cindy, or even Dr. Rakeli would like to answer that? That's one question. The rest was just asking if they'll be getting the slides. So I'm sure ISSUP will be sharing that with you. Yeah, you would get that notification in your email. So back to the question just now: isn't this approach to addiction very Western centric?
Okay, shall I take that?
Okay, go ahead.
Yes.
Okay. Yeah, thank you for the question. It has been asked by, I think, more than
Joe.
uh, more than 1%,
Yep.
or more, quite a number of people. It is European, based on European. No, uh, I don't think I want to attend INEP Plus if it is European. Yeah, but one thing, because we have also implemented it in the field, I I'm not sure what is European about it. Yes, it is based on developed based on the European experience, but I think the foundation, like the theoretical foundation, the principles of prevention, for example, what's common in especially in Malaysia, we do a lot of so-called prevention, but they are awareness campaigns, or very expensive awareness campaigns, spend millions of ringgit on awareness campaign, but well, there isn't any impact. Of course, there are people feel good, the politicians feel good that they have done this and that, um, but they don't understand what are the risk factors. For example, the multi component risk factors from the personal risk factor, as well as the what they call it, the social factors, the environmental factors, right? Things like uh, I think people in the healthcare, in the Ministry of Health in Malaysia would better understand it, because they have done prevention in the way that is science-based, which means it's not just about awareness campaigns. They have, for example, take the smoking prevention campaign. Not only education, not only awareness, but there's things like the coercion part, which is you can see coercion in the behavior change wheel intervention, which is coercion is about, you know, restricting sales of cigarettes in retail shops or in restaurants, and now the government is preventing uh, the shopkeepers from displaying cigarettes at the counter. So now you wouldn't be able to see cigarettes at the counter when the thing is enforced this year. Okay, and then last time, cigarettes you can sell per stick. You can buy per stick, so it is accessible to even kids. With just a few cents, you can buy cigarettes. Now, cigarettes can only be sold in like a 20 stick pack, so it is more expensive. Yeah? And of course, the tax, the financial burden of the tax. And there are regulations, for example, zoning of areas like in Sarawak, in Kuching waterfront, you cannot smoke in those areas. In those waterfront, you cannot smoke anymore. It's a no smoking zone, but it's open space, you know, no one can smoke there. So prevention is about looking at the risk factors, at the protective factors in the communities, looking at multiple stakeholders. Those are the basic principles of prevention. So I don't think it's uh, very European. It's more universal. Yeah. Anyone want
Uh,
to add to that?
Yes, I would like to address the question very briefly. Thank you,
Thank you.
Abel. I was really amazed and impressed by all the things that you've done and improved the course with the visualizations and with also the combi model, how you offered. So my really congratulations for all the great work you and Cindy have done. Great. So about the question, I understand and I also partly agree with it. It is Eastern based for especially the DPQS, the UPC, European Prevention Curriculum, the European Drug Prevention Quality Standards, of course. They have their roots in the European scientific evidence, but we also have the international standards from the United Nations Office on Drugs and Crime. Those are international standards. So what I think has to be done is to do what national chapter from Malaysia did. They, in the tips they gave, they really underline the importance to strengthen local capacity. That's what we have to do. We have to really support and empower what is already there, because there are good things and good initiatives, good prevention interventions everywhere. That's what we have to empower. And we have to dismiss or help to dismiss what we know doesn't work. And Abel was talking about offering only information, for example, or only empowering self-esteem. We know those things don't work. So the point is really to adapt to the local context and to the cultural background that is in each country. At that point, you will find your own strengths and you can empower them, or you can also align with things that the international standards offer or the European standards suggest, and you have to try if they work for you too. That's why, for example, the European prevention curriculum, before adopting it in other countries out of Europe, goes through a cultural adaptation with focus groups, with the stakeholders in the field of prevention that are called to come together and see what works for them and what does not work for them, because the cultural sensitivity and the cultural background is really important. Thank you.
Thank you, Dr. Rakael. And thank you, Abel, both of you, for the very detailed answers. There are similar questions that have been posted. Most asking whether can they get the slides, so on and so forth. So like I've mentioned earlier, you will be notified the availability via email. And about the certificates, you would also be informed via email within 48 hours. Yeah. So we are now a bit over the time to make amend of the missing time frame because of the technical issue. Okay, before we do a wrap up, let's do a quick wrap up quiz. Yeah. Uh, you can type in the chat box. I mean, Kwano will share with us the poll. What was added to increase engagement? If you notice from the presentation just now, what do you think was added to increase engagement? Just select one. Very good. Some really pay very good attention. Yes. You can see the poll answers, yeah, from on your screen, based on what Abel and Cindy shared earlier. So we can see a 67% on group projects. Obviously, that's the correct answer, right, Abel?
Yes. Yeah.
Many responses. Very happy of the participation. Okay, if you choose other option, that's perfectly fine too, because each strategies could indeed enhance engagement. But the standout edition of ISSUP Malaysia specifically emphasized today was the use of group projects. Thanks everyone for participating in that quick quiz. We also have questions just now, a lot of it, how to join the next cohort. So as you can see on the screen, yeah, you can, to find out more of the next cohort of INEP Plus, just go to ISSUP Malaysia Facebook, or you can just scan the QR code which is being shown on the screen now. So, okay. Before we officially close, we have 122, 135 earlier on. Do go to ISSUP Malaysia Facebook social media. We share a lot of information. We share a lot of what we do in Malaysia. Check us out. Like our page. Become our Facebook buddies. And you get to have more information that we can share. Yeah. So as we conclude, I would like to thank everyone, especially special appearance by Dr. Rakali. Thank you to Abel. Thank you to all the organizers. One thing I like to emphasize on an important point, the strategies and adaptations shared today are what work for us here in Malaysia. Yeah, each community or country has its own context. So what works in one place may not exactly apply elsewhere, but it's definitely worth adapting and trying these ideas in your context. We encourage you to take these lessons and tailor them uh, to your local environment. Innovation in prevention is often about testing, tweaking approaches to fit the audience. So we hope you feel inspired to do that. We did. On behalf of, yeah, I should show my face, yeah. On behalf of ISSUP Malaysia and our presenters, I want to thank all of you for spending your time with us today. We hope you found this webinar useful and engaging. A big thank you as well to Abel and Cindy for sharing their expertise. And if you like to continue the conversation or have any additional conversation or questions, do reach out to us. You can scan that QR code, take down that number, go visit us on our Facebook, and stay connected. Thank you, everyone. It was a great webinar today.
Thank you. Goodbye, everybody.
Bye. Thank you.
Goodbye.
Thank you.